Hi, I am Dr. Shauna Roberts. My husband and I own the Polo Animal Hospital in Polo, Illinois. We have various dogs, cats, barn cats, garage cats, and chickens. I usually find the horses that need the most care and purchase them online, sight unseen. I rehabilitate them, feed them till they're fat and sassy, and then I find an owner to love them. What attracted me to Memphis Slim was his kind eye and his calm demeanor, and he just seemed like a really agreeable kind of horse. I actually found out from one of the ladies at the sale barn that they had used him for racking races, so he had actually been in a gated horse race. When he developed heaves, I'm sure he wasn't useful to them anymore, and that's probably how he ended up in the sale barn. When he arrived on the property, he was pretty depressed, extremely thin, poor hair coat, pretty dull in the eyes. He had been through 3 sale barns in about 3 weeks, so he kind of was wondering what had just happened to him in his life. I noticed that he was having trouble breathing about 6 days after he arrived here. It was in the dead of summer in northern Illinois, really humid, sticky, hot, lots of ragweed around. I just came out one morning and I was really shocked at how quickly his breathing had become very labored, loud. I could actually hear him breathing as I walked into the barn. The clinical signs I noticed were first off, the flaring nostrils. He had a lot of respiratory noise, especially on expiration, a wheeze and sometimes even a squeak or a honk. That was the most alarming part of it. A lot of abdominal effort to his breathing pattern. His initial treatment, I started him with dexamethasone. I gave him his first doses IV, and then we switched to oral dexamethasone. After about 4 days of that treatment, I started to become leery of giving him that much steroid for fear that I would cause laminitis, and I did add oral clenbuterol to his treatment. The ragweed pollen count got even higher, and it started to become apparent that the lower dose of dexamethasone, even with the clenbuterol added in, was not going to be adequate to make him comfortable. And that's when I found the Aservo EquiHaler. I ordered that and had it drop shipped overnight. I found that the results happened very quickly. Within 3 to 4 days, his respiratory effort was almost back to normal. He wasn't just standing in one spot trying to catch his breath. He started to eat better and he started to look much more comfortable. I feel like the Aservo EquiHaler definitely caused him to feel much better and has definitely given him some quality of life.
Important safety information. Aservo EquiHaler has not been evaluated in pregnant or lactating mares. In a large clinical field study, the most common adverse reactions reported were coughing, nasal discharge, sneezing, and nasal irritation, bleeding. Concurrent use of other anti-inflammatory drugs, such as non-steroidal anti-inflammatory drugs, NSAIDs, or other corticosteroids, should be approached with caution, not for use in humans. Keep this and all medications out of the reach of children.